Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended several weeks after I first saw them, where they presented with a right-sided ear infection, so this is their right ear. And after removal of all the infected debris, I referred the patient to their GP so they can receive the appropriate medication. Whenever we perform microsuction in an ear that's infected, although we can clear the debris and alleviate their symptoms, the underlying bacteria or fungi or even sometimes virus that's the root cause behind the infection is still present. So at any stage it can recolonize and reproduce, and the infection spiral starts again. So it's very important, as soon as we clean the ear, they can get the appropriate medication, and for the mainstay, the most appropriate medication is topical antibiotics or antifungal, if that's the root cause behind the infection, because it makes direct contact, so it's a lot more effective compared to systematic medications, so oral tablets, for example. And so with this particular infection, it's bacterial, so the patient was prescribed some topical antibiotics, which also contained steroid dexamethasone to reduce the inflammation that was present, and also acetic acid. So the acetic acid helps to reacidify the ear. Our ear is naturally acidic, around 5.4 to 7 pH. And when you've got an ear infection, the pH level of the ear rises, and when it rises, sometimes it can also become alkaline, it can go above the 7 threshold. It just allows harmful bacteria and fungi to reproduce. So the reacidification of the ears, it helps to inhibit further bacterial and fungi growth. And the way the antibiotic works, it doesn't actually kill the underlying bacteria, but it stops it from reproducing. It attaches to an organelle called a ribosome. And the ribosome is very important in terms of cell replication. So it reads the genetic code and it sends another portion of the ribosome out to collect all the amino acids in order. So chains of amino acids then create proteins, so it enables the bacteria to reproduce itself. So these medications, these antibiotics, they're called aminoglycosides. There's different, any antibiotic, any in mycin, so MYCIN or MICIN, they're known collectively as aminoglycosides. And other examples are streptomycin. This one, in this particular medication, was neomycin. You got erythromycin, gentamicin, for example. And the net effect these antibiotics have is that the superficial layer of skin, so the outer epidermis layer, with all the infection sitting on there, it almost coagulates and it crystallizes and it forms into this biofilm which lines the ear canal. So we're just peeling all this away. So this is post-infection debris. So the ear is no longer infected, but you've got this residual debris as a result of the original infection. And it's not only lining the ear canal, so it can prevent sound waves from being effectively channeled and funneled through the ear canal to the eardrum, but this film is also on the eardrum, so it's thickened the eardrums, made it a bit more callous, so the eardrum is not going to vibrate as much. So I'm just using the fine end and I'm just gently peeling this away. It's a bit of a difficult ear because it's quite narrow. I think you might have seen that also in their healthy left ear. When we examine the ear, you can see that there's a bit of stenosis. The ear canal was narrowed as we approached the eardrum, and it's the same here. So I'm just peeling away some of this biofilm from the back part of the ear canal. It's quite sticky, so it's sometimes more tricky when it's sticky. You can't use any other instrumentation. Sometimes if the biofilm or like a dead layer of skin, for example, is crusty, you can lift it off the canal wall and use some microforceps to purchase it and extract it. But in here, the forceps will just cut through this biofilm because it's obviously too soft. So this part of the ear we call the isthmus. So this is where the ear canal narrows and it widens again. Most of us have the isthmus. It's actually the second isthmus. The isthmus is just the medical term for narrowing. The first isthmus in the ear is between the first and second bends of the ear canal. So the first bend is about 0.5 centimetre into the ear, the second bend a further 0.5 centimetre. So in that region between the first and second bend is a very narrow portion of the ear canal. And then we have a natural second narrowing here. about 1/2 centimetre away. And so the ear canal narrows and it widens anteriorly, so to the front part of the ear canal, so in the case of the right ear, the right side of the ear, and also downwards towards the eardrum. And that creates two pockets. It creates a pocket anteriorly, so to the right, so we call that the anterior recess, and it also creates a pocket or a basin, trench if you like, or pothole even, inferiorly to the floor of the ear canal where the eardrum is. And sometimes you can get dead skin accumulation, or if people are using cotton swabs to push, trying to clean the earwax, you can push it beyond that recess and it can form a plug. So peeled away most of the ear canal, and so this is the cartilage portion here. Now we're just encroaching the bony portion. You could see the cartilage actually move there as I was peeling it away. So when we work on the cartilage portion, you can apply a bit of pressure on the ear canal, but on the bony part where we are now, near the eardrum, it's like that game of operation. I've mentioned it in previous videos. You're just going to try and avoid contact. It's not always possible. Sometimes we do make minor contact, but it's so minor patients don't feel it. I mean, in the past I have made a bit more contact and patients have felt it and made me aware that they felt it, but we're just going to try our best to avoid that. And we're just gently peeling it away. And because it's quite adhesive and sticky, it's just a bit more tricky. It's not coming away as easily as I hope. So I'm having to, as I'm getting a suction grip, pull away and go back and pull away. And I'm doing these short movements. So just posterior of the eardrum to the back part of the eardrum. And fortunately this came away in a nice piece. So you are going to see some general flakes. There's a bit of skin there. You can see that's the tail end near the eardrum. We're not going to try and remove that because that is on the eardrum itself, but the eardrum's fully visible. I'm just going to see if I can get some off the bottom part of the ear canal. And this patient does suffer from chronic otitis externa. So the name of the infection is otitis externa. Otitis is the term for ear infection. Externa is the part of the ear that's infected. So in this case, it's the external part. So the external part of the ear is the outer layer of the eardrum. So the eardrum's got 3 membranes. The ear canal itself, and then the cartilage that sits on either side of our skull. So they'll call that the pinna. So if any of those 3 parts are infected, we categorize that as otitis externa. So they do suffer from chronic otitis externa, predominantly in this right ear. And as a result, you can then develop stenosis, which is a narrowing of the ear canal. And I suspect this patient has developed that over the years. So it's just due to the inflammatory process, and it can cause narrowing of the ear canal. But I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.